Okay, we are live streaming now.
Good morning. The time is 9:04 a.m. The date is April 4th, 2024, and I'd like to call the regular meeting of the JLMBC to order.
Oh,
Good morning. The time.
sorry, there's a delay. Okay, we'll go ahead and do roll call.
But no, my voice is awful. It sounds like I have anyway.
We'll go ahead and do a roll call. When I call your name, please confirm your attendance and we'll go and order the agenda. So Dana Brown,
Present.
Tony Royster,
Here.
Matthew Crawford in for Matthew Rudnick.
Here.
Paul Gerard in for Matt Sabo.
Present.
Petty Santos in for Holly Walcott.
Here.
Shauna Janeway in for Janita Igualier.
Here.
Marlene Fonseca.
Here.
And Esteban Lizardo.
Here.
Thank you. Public comment?
For those who are participating telephonically, if you could press *9 on your phone to put yourself in the speaker queue. For those who are in the room and like to make a public comment, please bring your speaker card to the front. Seeing none and hearing none.
Do you have to give an amount of time or we're good? We're good? We don't have to do Jeopardy music. We're good?
Yeah, no, yeah, okay, no, we're good.
Perfect. Thank you. Item number 3, action item, the minutes. Do I have a recommendation to approve the minutes of January 4th, 2024 regular meetings?
I would so move to approve.
I have a motion to move. I have a second.
I have a small amendment is that I work for the Office of Finance.
Oh,
Not the Department of Recreation and Parks, but
we will,
that's Rudnick's year on there. But
we'll make that correction.
other than that, I'm on board.
Okay, so we have a motion as amended with a second from Matt. Yes,
Yes.
lovely. Okay,
All right, we'll go and order the agenda again. Dana, your vote.
aye.
Dana votes aye. Tony, your vote.
Aye.
Tony votes aye. Matt, your vote.
Aye.
Matt votes aye. Paul, your vote.
Aye.
Paul votes aye. Petty, your vote.
Aye.
Petty votes aye. Shauna, your vote.
Aye.
Shauna votes aye. Marlene, your vote.
Aye.
Marlene votes aye. And Esteban, your vote.
Aye.
Esteban votes aye. It's unanimous. The motion passes.
Thank you. Moving on to action item number 4, committee report 2416. No.
Sorry, I was supposed to remind you, we're wanting to take the item number 5 out of order.
Thank you. All right, thank you. So, so we're going to move to item 5, skipping item 4 for just a second. Item 5 is an informational item. It's a presentation of the Workday HRP system.
So the JLMBC had asked, we've been talking about the Workday presentation or the Workday system for quite a while in this committee, and the JLMBC did ask for a demo. We talked with the Workday team and tried to get the Accenture consultant in to give a demo of the system. They weren't available to meet this meeting, but we do have Workday to present for us today, as well as some of the HRP team staff to support with any questions. We have asked them to focus this demo on the items that we talked about in committee so far, which is the employee-facing focus of onboarding, getting the employee on, particularly that date of birth issue that we've been talking about in committee, and also what the employees are going to see when the system goes live, to be able to view their benefits, to enter their time, because time is a very crucial part towards the benefit eligibility portion. So those are the topics that we asked them to present on today. I'm going to pass it over to Ann Putz from Workday.
All right. Thanks, Paul. Good morning, everyone. Can you hear me?
1 second, Ann.
Okay.
Change your audio. Okay, that should have fixed it.
Listed as number 9.
Okay. Can you hear me now? Is that good?
Turn that up a minute. Oh, that is on.
Let's see, why aren't we're not hearing you, Ann, for some
No?
reason. Oh, we can hear you now.
Okay,
We can see
great. And then I'm going to go ahead and start sharing. Which will mean whoever's sharing now will no longer be sharing. So let me go ahead and go into Workday and let me know if you can see my screen.
Yes.
Should be coming up. Okay, great. So like Paul said, I'm going to first go in and show you what a new hire would see as far as the onboarding experience is concerned. So I am proxied in on as a new hire, Charles Brown. What they will first see in their inbox is an item for them to go in and update their personal and contact information. So this item, you'll see these items in red that they would have to fill in. So I'll go ahead and process this first item. So we're looking for the sex, the date of birth. We will go down. They can enter additional information if need be, but again, these ones that are in red are the ones that are specifically asked for. This address would come over from any information that was entered on the pre-hire if they needed to make any additional changes to that. And then they can go ahead and submit this change. Let me go ahead and open it because it's giving me an error. And let me just submit that again. You can see that if they don't submit everything, it's going to give them an error. Charles does not have a primary home phone, but we want to collect that from him. So we will go down and add that home phone now. Go ahead and select a mobile phone. Go ahead and submit. Once he's submitted this, he'll get another pop-up in his inbox asking him for his social security number. So he can go ahead and add the social security number.
And before you do that, I
Sure.
think there might be a question, and I wanted to make sure to point out a thing. So if you could cancel that step for just a second.
Yep,
and
absolutely.
go back. So even so what we talked about a lot in this committee has been this particular point exactly. So even though they put in their date of birth, this outstanding step is required for that date of birth to pass to our system. So because if somebody did what Ann just did and said, okay, edit government ideas, I don't want to do that, and they just move out, they have not done the required action of giving their date of birth in a format that's going to be able to go to us so that we keep them that offer. So this is the crucial component where we've gotten employees very confused. I think there was a question.
Yes, I do have a question. Hi, Ann. This is Dana Brown from the Personnel Department. So I'd like to just kind of set this up like for perspective. The what you're doing, does the employee already work for the city yet, or does the employee not work for the city yet?
It depends on, I think these are going in, Marvin, you can correct me if I'm misspeaking, but these do not go to pre-hires. They are at the city already. Is that correct, Marvin? We're not sending this out to pre-hires?
Hi, this is Marvin. I'm with the personnel department on the HRP team. I'm over the HCM work stream, which is the HR portion of Workday. To answer the question about whether, pre-hires will see this, basically, once HR completes the hire process in Workday, which can be before the employee is hired, the employee receives these steps in their inbox. It will initially go to their personal email account, and then when they start with the city, they'll access it through their city email account.
Okay, so I don't want to be, it's important that we sort of understand at least, whatever example that we're using, that we know what we're looking at. So, like, for example, if this is being done on an employee's first day, but the employee is, I don't know, a sanitation worker, then likely the employee is not going to see this. So I think that I know that we try to do the pre-hire. Is that not so? I wish I had a personnel director, and I know, Marvin, definitely has that kind of background, but has been very much for the last many years involved in the configuration portion of the HR module, as opposed to being an end user, a personnel record supervisor, a personnel director who's actually kind of, doing the onboarding. And so, I mean, I think that, for us or for me, it would be really helpful to start at the very beginning, taking us kind of down that road so that we can see where the roadblocks may come up.
We didn't set it up that way. We can set it up, but I'm not sure that we could do that in the time we have today. That's, I guess, my question for Ann and Marvin.
I think we would probably have to maybe come to the next meeting or something, if that would be okay, and show you the entire hire process. And then you can see where it gets to this point, if that's all right.
Right. That's fine. I want to see where the employee is initially engaged, either employee to be or actual employee, because I feel like within those steps, we can sort of identify, kind of where some of the snags are more likely to happen.
Okay. Yes, we can definitely, do that at a future meeting if you want.
I agree with Dana, because you have two processes. You have the process of individuals or classifications that fill in their own information. Then you have some of the people like to work for other departments, like sanitation, PSD, where you have custodians, mail and messenger clerks that don't fill their time out. And this information would not come to them because they really don't have accessibility to it. So we need to really understand both processes.
And that hits on a good point too, that I think maybe we could ask Workday to explain in this step here. So for this particular, the crucial step that we've been talking about for date of birth, what happens or what is the process for exactly what Tony was asking for an employee that's not going to have access to a computer? Are they still expected to fill in their own date of birth, or is HR going to be doing that for them? And maybe that's more for Marvin.
Sorry, I was tracking my unmute button. But yeah, the answer is that in cases where the employee isn't able to fill out this information on their own, HR has the ability to reassign the task and fill it out on behalf of the employee. And for some departments, that is the matter of course, particularly for rec and parks.
Okay.
Okay, so we'll talk about bringing the full hire process, but at this point, I guess we're ready to move forward. So the employee, either way, it has this extra step to complete.
Yes, we'll complete this step. We won't go through the entire onboarding process, but at this point, they would enter their social security number, submit, and then at this point, they're going to get a whole bunch of things in their inbox as far as other information we want to collect, but I won't go through all of these. These are the two crucial pieces of information that we need for the benefits integrations. But at this point, they would be adding emergency contacts, driver's license information if needed, tax selections, all of that. The other thing I wanted to show you here is, we don't have a lot of benefits configured in Workday because, you have a third-party provider for those. What the employee can do, though, is go out and take a look at these links. So these links are specific to the individual. So this Charles Brown is actually a civilian employee, so he would have access to LACERS versus someone who was sworn might have access to LAFPP links. I added this last one. I'm not able to click into these to take it to another window, so I just added this other link so that you could see what the employee would experience. It would take them to one of these other links that was specific to their job and what they're eligible for. So that is kind of the new hire experience. And I know Paul wanted to me to show you also how to request time off, take a look kind of at the absence and the time entry piece of it. So I'm going to go in as an.
Oh,
I'm
sorry. Sorry, before you do that, I just want to make sure that everyone understands what she just showed you. So what she just showed you, that benefits and pay tab, that is going to be the only exposure. Can you actually click on the full tab? Are you able to?
Like
Yeah.
to see everything? Yes.
Yeah. So this is the menu that employees are going to experience, any employee, when they go into their own account. And that benefits tab there, if you could scroll up a little bit more, and someone clicks on that, if they actually clicked on it, they would be able to see some benefits, but not our program. The LAO program is not configured into the system. It is just a file feed of data into it. It is all configured and managed in our third-party record keeper. So they're not going to see the LAO program here at all as benefit elections. It's only going to be that link that brings them to that third-party record keeper site. This was as good as we could set up to try to make that as clear for an employee to understand why they don't see their healthcare on this elections link or page.
I have one question about the, I noticed when you entered the social number, it has two fields next to that, issue date and expiration date. I'm wondering if an employee who's filling this out themselves types in there, if this is a required field, they type in their social security and they say, oh, issue and expiration, I'm confused. Let me cancel and figure that out first. And now it's not, it's a week later. Is that going to be an issue?
And were you able to hear that question?
Yeah, I did hear that. I don't know if someone from the city, if they've seen that issue happen, because this is already something that the employees are filling out. Have we seen that in the city?
I think that we've seen problems, we just don't know why. So I mean, I think that was to Shauna's point, that is certainly a line of thought that is quite, believable that somebody could have such an issue. And then become uncomfortable because their social security number is involved, just kind of back out and figure, I'll just wait till I get to work. I'll just wait till I can talk to somebody. And the problem is that a lot of that waiting keeps us from, processing what needs to be processed for, in this case, benefits.
Yeah, and I also know that there is a report that I believe they're using to monitor that the departments can use to track where people are within the process. I don't know how often they are running the report or monitoring it, but there is a report. I think that Marvin, I think your team has been pretty vocal about getting the departments to kind of watch people and how they progress through the onboarding process now that we've heard all these problems.
Yeah, so we've done several things to try to streamline the online process to the extent that, the Workday configuration allows us to. And our primary focus has been on providing departments with the tools to be able to review and audit and ensure that onboarding is complete. At the end of the day, it is incumbent on the department HR section to ensure that each employee completes onboarding.
It doesn't look like there. Oh, yeah. Go
Sorry,
ahead.
just a quick question. So I saw in the beginning, as you were going through the fields, there's a way to notify the employee in red that they need to go back and do something. But it seems like when it got to that other section that they can just kind of skip and not do, there isn't that warning. And I was just wondering, is there a plan to build in some type of warning saying you're not done, you need to go back and do this, as opposed to just an audit report that the HR folks have to find? So that the person actually doing the fields knows, oh, shoot, I have to do that.
I don't think there's a way for us to necessarily say, because they haven't started this. The other one I had started and I made an error. They haven't started these processes. We do have some tools within Workday to create what we call alerts that could say, you're not done yet, you're not done yet, you still have things in your inbox. That's one way to do it. But I don't think we've done anything like that at the city, but that's something that the city could look into implementing some sort of alerts to say, you know, your onboarding is not complete. And instead of relying on the HR departments to do it, they could, you know, technically send something to the employee instead. But still, somebody's going to have to follow up if the employee still isn't completing those items.
Marlene?
I heard you say that if it's not complete or if there's next steps to do, there's these messages, I'm assuming in that little bell or inbox up there. Do they also go to the employee's email or are they connected at all, or is it them relying on them coming back into the system to know they have a next step or message or alert?
No, this should go to the employee to say you have a task in your inbox,
Like
in your workday,
in their
their email. Yes.
Whatever email
They have.
the HR put
Yeah.
into the system for them, or that they added themselves.
So it could be home or work, personal or work.
That's right, Ann, right? Like whatever.
Yeah, because Marvin, you might be able to speak to this better, but do they just have their home email until they become an employee and then it gets changed to the work email?
That is correct.
It doesn't look like there's any other questions at this point, Anna, if you want to move on to the
Okay.
timepiece.
So I'm just going to go in as an existing employee.
As Ann is speaking, I just wanted to point out that this is not something that's started yet, right? The onboarding HR module is already active, it's already live, and that's what we're already doing. The time piece is a part of phase 2 that's not active yet. So just for perspective.
Thank you. So I'm going to first go in and request some time off for this person. So I'm going to go in and request absence for Anthony. And let's say, and over here on the left-hand side, you can kind of see each of the different banks and how much he has accrued, how much time he has to use. I'm just going to go in and say he's requesting to take tomorrow off. So I'm going to request 1 day of vacation time. So I'll go up to time off. We'll request 1 day of vacation. If he was going to, request more than 1 day, he could update that here, but we'll go ahead and submit this. This would then route to his manager for approval. So I'm just going to quickly go in and approve that time so that we can see it on when he enters his time. So go in as Angela, and we'll go ahead and approve the time. Just going to go ahead and approve that. And now let's go back to Anthony, and we'll enter some time for Anthony.
Is everybody following what she's doing? Okay, first
Yeah.
she was Anthony, then she was his supervisor. Now she's going back to be Anthony.
Now I'm going to go back and enter my time for the week for Anthony. So I'm going to go ahead, I'm going to go down here to time. And I'm going to go ahead and enter time. You'll notice I have 8 hours already this week. I'm just going to enter time for this week because that vacation time came in from the absence module. There are a few ways that I can enter time. I'll show you a few of those. I'm going to first do my quick add. So basically, I'm going to be entering some hours worked for him. So how many hours a day am I working? So I need to enter some required work tags is what we call them. So we want to make sure we enter the department. He works for the zoo. The work order that it applies to. And I'm just going to pick some that we have set up, and a task and subtask. We'll go ahead and just pick those items. When I say next, I can specify which days I want to put in for these hours worked. So let's say I'm going to work Monday and Wednesday. Maybe I usually work Fridays, but I have that PTO scheduled. So I'm going to go ahead and say okay. And now you'll notice that these 8 hours of work are showing up on Monday and Wednesday. You'll see he also has a warning here saying that the time that he's entered doesn't match his work schedule, because in essence, he should be an 5 days, 8 hours, 8 hours a day. So we're missing time on Tuesday and Thursday. So let's go ahead and enter some additional time for him. I'm going to show you a different way we can enter the time by type. So if I go in and I add an additional row, maybe he is going to be telecommuting on Tuesdays and Thursdays. So this is hours worked, but I'm telecommuting. We need to ensure that we have these same work tags. So I'm just going to go ahead and type in work tag 87. I could search down here, or what I can also do is I'm just going to copy these. So I can click on here, I can copy the text and pull them forward up to this day. Oops. I can hit the right button. And then we'll go ahead and copy this last one. So we have the proper department and the proper work tags associated with, just do a good, there we go. With the task, and let's say he's telecommuting on Tuesday and Thursday. So I'm just going to save and close for now. What I wanted to point out is we no longer have that warning because he's got hours entered for each day that he is supposed to work. And I think what these employees will be doing is going to be entering time for 2 weeks at a time. So what I can also do is I can autofill from my prior week. What it's going to do, it's going to pull forward that data from last week. I could specify which week I want to pull it forward from the past 5 weeks. I'm just going to pull that time forward from the previous week. So we also want to say we want to copy the details and comments because that's going to pull over all of those work tags that I entered. So if I say okay here, you'll notice that Friday didn't come over because I didn't request Friday off this week. I just requested it off last week. So again, we're getting that warning that I'm, my time entered doesn't match my schedule. So I can go ahead and go in and update my hours for Friday. And maybe he's just gonna, he's not telecommuting on Friday. So we'll go ahead and enter 8 hours of time for him. We can save and close. We should see that warning go away. And at this point, we can review the time and then he can submit the time to be approved. So that is kind of the experience for, requesting some time off and entering time and submitting time.
So since our benefit program is crucial, or eligibility is crucial on hours, a half-time employee has to have 20 hours in a pay period, a full-time employee has to have 40 hours in a pay period, 50% of what they're expected to work in order for benefits to continue. So employees are this is the process they're gonna go through to ensure that they can get their benefits and not get a nasty bill from us, or to get their new hire offer or their first-time offer from us. Not all employees are going to be physically entering a time like this. There are a couple departments that are keeping with a file feed. LAPD for sure is going to be doing their timekeeping on their own part separately and feeding into the system. But the majority of employees will be doing this process. Ann or Marvin, could you speak to the employees that maybe are like sanitation workers or someone who is not maybe going to use the system, will payroll record keepers be doing this for them, or is there a different process for that?
Hadiera, are you still on the call?
Yes, I'm on the call. Good morning, Hadiara from Time Tracking Lead. So I am not aware that sanitation is not going to enter time through our module. I presume the DPL, the Department Payroll Liaison, would make those entries, or the timekeepers for those that are on the field and cannot do this. We do have a module, a mobile app that can also be utilized for those who can.
Thank you, Hadiara. So to be clear, everyone is, those other departments are going to be using this module. It's just that some of them may have people who actually enter the time for field staff who are not, who don't have access to equipment. However, also to Hadiara's point, there's also a mobile app that employees can use, even administrative employees who are not perhaps in front of their in front of their desktops at work. They can still use this mobile app in order to get their time in. So, this time module is not so different from D time that we're used to. We are, and I believe we're also going to still kind of operate in the same way. Those departments that currently don't have employees go into their own D time will continue not to have employees go into their workday time. They will have people who do that for them. So we are looking forward to a smooth transition to the workday system that has a certain, more information available for employees who go into the system. You can see more things. And obviously with the added benefit of being able to, no pun intended, of being able to request time off through the system. So it's not so different from D time, I want to say, as it relates to time tracking itself.
That is correct.
Quick comment. I think the most important thing is making sure that we have the appropriate information in the system. Make sure that each employee is receiving their benefits. And time, as you say, is a critical thing. Either in the employee administrative is responsible for that, or either we have timekeepers, as we do in GSD, to make sure. Another question is there anything else that you see in this program or system that's going to cause you some obstacles or issues as it relates to benefits that we need to talk about or discuss before we go to another subject?
So what we've shown so far for the employee focusing view, what every employee is going to see, I don't think there's any other concerns on those actions, just that employees know to enter their time and in the time period. It is the calendar, the process of when they need to do that is going to change. They need to do it sooner than they currently do. But just for those components that we've shown for there doesn't seem to be any other concern. We still have the concern about the file feed discussions, which we've been talking about in this committee a lot, and that still is a concern.
Because the big difference you have now versus the new process is today, administrative, whatever classifications, do not implement or input this information to have their benefits activated. That's done by personnel, correct? Today, or does an employee does that?
So the only thing that's really different today versus in the future, well, actually, no, because onboarding is happening today. So there is no difference.
So there haven't been any issues or anything?
I think the only real difference physically is the absence part. In today, at least it varies by department. Every department does their request for absence differently, and then it gets recorded. So this concept of the employee has to say, I want to take this vacation through the system, has to be approved. And that's the only way. It is a fundamental difference, but it's not too far off.
Just when this last question, if for instance, if the employee submits a request for vacation and for some reason the supervisor doesn't approve it, what happens? I mean,
don't know.
it doesn't respond. I'm not saying
are-
they're rejected or denied.
We're still exploring. We're still trying to understand how this is going to work. There's still a lot of questions as far as retroactive action. So I get paid a certain amount and then I do something else and that applies differently. We know how it happens currently in the system. We know the theory of how it's going to happen in this future system. We just haven't seen it. At least I haven't tested it out enough to know what the benefits implication is going to look like. So those are still components that we are going to be discovering together.
Yeah, I would say to Tony's point, it's not so different than, even, those of us who still use sort of a paper, what is it, a blue sheet? Is it green? Is it blue?
Blue.
Blue. Okay, so if you give your supervisor a blue sheet and the supervisor doesn't sign it,
Right.
that's the same as your supervisor not approving it in Workday. So, you wouldn't be off until the supervisor approved it. And you wouldn't be off until the supervisor gave you your blue slip back with the NCR copy. Welcome to
No, yeah, I mean,
1987.
but I mean, the blue sheet or whatever like that, if they didn't approve it or disapprove it or whatever, if it's still like in limbo, it still wouldn't impact your benefits. Where in this system, if it's not approved, whatever, it really determines what your hours are, right?
Well, I'm sorry.
Oh, no,
I was going to say, so this is just timekeeping. At
Right.
the end of the day, when you get ready to do your time, either you worked that day or you didn't.
Right.
So you just have to record it, whatever it is. And so I would think that if your supervisor didn't approve the day off, then you would have worked that day and you will record your hours as hours worked.
Okay.
Yeah, the scenario where it wouldn't be would be if there was a disagreement and they did leave without pay for that day, right?
Right.
And that would be if there was enough leave without pay that would drop you below the 40, then that would impact. And that happens today.
Okay.
In scenarios. I think you had a question?
Is there any reason why the links to the benefits pages can't be underneath the heading of benefits? Like, why are they so separate from each other, web design wise?
Anna, did you hear that question?
Yeah, it's just the way Workday is configured. We don't have the ability to do anything to change that. I can see if it's on the roadmap. They're continually adding updates. I did see somewhere where somebody was asking kind of the same type of thing. Could it, be moved up under benefits? Could the benefits be separate from the payroll? So I think there's some rumbling out there, so we can keep an eye on that and see if Workday is going to change that. But for now, that's kind of just where we have the ability to put it.
I'm not sure if there's more questions, but I did want to do a time check. We do have a heavy agenda. And it sounds like we will be we're talking about this a lot more in the future.
Yeah.
So no more questions. Thank you, Workday.
Thank you.
Thank you so much. Okay, so we will go back to our action items. Item number 4, which is a perfect segue from our last discussion. Item number 4 is a committee report 2416. Which is related to new hire benefits eligibility. And this is a proposal that staff would develop a proposal for changing our LA Well program plan rules and allow newly hired or rehired employees to elect benefits on their first day of employment, which would be a plan change because, as you know, we do not offer benefits election on the first day of employment. So I am very interested and eager to hear this report.
And I'm going to start it off. I'm going to start with further down in the report as to why kind of this is coming forth as a question in the first place. So we do have, or there has been, up until the freeze, a lot of focus on recruitment and hiring. And there are situations where employees are very focused on their benefit package and wanting their benefits to start right away. It happens in the private sector, a lot. It is not common in the public sector. So it has been on multiple occasions a difficult conversation with a new hire employee who's not understanding that they have to wait a period of time to be able to get their offer from us. And then sometimes those employees might even get impacted by not working the full pay period and not getting the required hours for us to give them the offer. And so they have to wait longer. We talked with Siegel, our consultant, about a year ago or so, and kind of tried to look at to how we compare in this delay of offering a package. We are common, or our practice is common in public sector. Our physical action, which is further down in this report, if I can get to it in a second, because I'm going to skip around a bit. Our physical action of having it linked towards the pay period and hours worked, and then doing the offer subsequent towards that is not common typically from what they were seeing in their research. But it is common that there is a delay. So attachment F shows what they've had identified and found. In most public agencies, an employee starts work and then usually the calendar month or a period of time afterwards is when their benefits start. We are not on that schedule. We do it by per pay period. Our eligibility is throughout per pay period. We looked back to try to understand how our rules worked and why they worked and how they've been that way, because they've been that way for a very long time. There's not a lot of record from prior to the late 90s or so, at least not retained record that we could find. But we do understand why the JLMBC was created and its focused at that time. So the JLMBC was created in the 90s really to create this cafeteria plan that we have right now. And it was created with the idea and focus of curbing costs and making this pre-tax benefit concept for city employees and to improve the program. And in that conversation, it looked like the curbing cost part also, at least documents that we found so far, led towards the 40-hour rule for employees. This is back in 1990 something. And it's been enforced that way. In current day, the 40-hour rule, I'm sorry, I'm skipping around a whole bunch of places. The 40-hour rule does save the city a substantial amount of money each fiscal year. Because there are a number of employees who go on unpaid leave to go on certain actions. They still are actively employed, but they are not working. And so in those situations, we bill them. There are, I had it in here, our actual figure. It is approximately, oh, where did it go? About $2 million a year that we are saving by not giving benefits to, or not subsidizing the benefits, I need to clarify that, to employees who are not actively working, but still employed. So we looked back in kind of the overall program itself, and documentation started in the 90s were showing that those rules were in effect in that time, and really the plan design that we have today was really in effect in that time. From 1996 on, our benefit package looks identical. So in trying to see how to do something different, if there was a desire to move the model and be able to change when we make benefits effective, there's a number of things that we could consider on looking into this concept and create a plan of what this potential rule change would be to be able to offer coverage on day one. We could do a couple different ways of doing this. We could completely restructure how our program works and then still keep the 40-hour rule moving forward. We could offer a couple different options completely on how we look at the 40-hour rule. We could essentially entertain an idea to suspend it for the first month or so of hire. We could look at a few different ways of trying to align our coverage with what we're offering to ensure that there is more ability, more flexibility in being able to make a change happen if there is a desire to do so. So I'm going to pause talking for a second. There's a ton of information in this report, but this report itself is just, is this committee interested in entertaining this subject further? And then we would go back, put together a rough plan or multiple plans, and that bring that back to this committee for further discussion and potential adoption. This would be a physical rule change. It would have to happen kind of along with our plan year rules. So it would either be starting in 2025 or later, depending on what we're able to put together for a timeline. It would be a programming change to the system. It would be an advertisement change to all. It'd be a big change, but it would be a change that we would have to plot out and discuss at least one other meeting or multiple other meetings on how we could time it moving forward.
Okay. Thank you so much, Paul. I mean, I'll start the conversation by, openly, this is a big deal to me. I know that since I have been at the personnel department, we've had multiple conversations about this. And basically for me, it's not as much about whether or not we are providing benefits to someone who is not actively working or otherwise adjusting the 40-hour, 20-hour rule. It's more about when do we offer benefits to people who we have hired. And so obviously in the last year, we have had a ton of new employees. We have a new mayoral administration. We have a new city attorney. We have a new controller. We have several new council members, and all of those people come with new employees. On top of that, we have had a push to fill vacancies, certainly within the last year. And one of the targets that we had was bringing people into the city who already had work experience. So inviting middle management talent into the city of LA so that we can take advantage, obviously, of the talent and the professional experience that they've had elsewhere. As I look over at Marlene, the management analyst exam that we gave to open candidates was just monumental. We had thousands of candidates who were interested in working for the city of Los Angeles, but obviously have work experience, have jobs. And so the idea that we would invite them into city employment without offering them benefits until they met, a particular criteria, for me, seem like something we should take a look at. On top of that, as we move into Workday and move into a new system, as we just discussed in the last presentation, that onboarding we're still sort of working out kinks in onboarding that are directly related to our ability to offer benefits. And so, for me, looking at, what it would take to at least offer benefits upon employment is worth the research. I don't know that everybody would actually even elect. Probably if we looked at even now, whenever we offer the benefits, what percentage of people don't even elect? They don't even do the thing. I think that there's a large population of people who fall into that category. But those people who need benefits because they are, dealing with some sort of chronic condition, particularly those candidates who have worked somewhere else for a number of years and are coming into the city of Los Angeles, possibly with the responsibility of their families and so forth, and have to wait for 4 to 6 weeks for a benefit election. I think it's worth looking into.
So I would move that this committee direct staff to develop an implementation plan for the rule change.
Second.
Okay, then we can go ahead and take a vote. Oh, is anything?
No, I had a conversation with myself. I love it.
All
All right, let's do it.
Okay, we'll go in the same order of the agenda. So Dana, your vote.
Aye.
Dana votes aye. Tony, your vote.
Aye.
Tony votes aye. Matt, your vote.
Aye.
Matt votes aye. Paul, your vote.
Aye.
Paul votes aye. Petty, your vote.
Aye.
Petty votes aye. Shauna, your vote.
Aye.
Shauna votes aye. Marlene, your vote.
Aye.
Marlene votes aye. Jose, your vote.
Aye.
Jose votes aye. Esteban, your vote.
Yes.
Jose votes aye. It says yet aye. And Lisa, your vote.
Aye.
Lisa votes aye. It's unanimous. The motion passes.
All right, thank you very much. Moving on to informational item number 6, we have a benefits provider presentation from TELUS Health regarding the 2024 open enrollment debrief, service performance, and planned enhancements.
Thank you all. Kevin Canoon with TELUS Health. I'm the Vice President of Client Management.
Amy Kivior, I'm a client service manager.
So Amy and I are going to tag team a bit today and give you an update on how we proceed with annual enrollment, give you some statistics. There'll be some information that was requested last year by some of you that's in the report now, and open the questions. So we get started here. Paul, if you want to go to that first slide. So the good news is not a lot of material changes this year. It was a passive enrollment. Passive enrollment is where your members aren't required to go in and do anything, with the exception of your reimbursement accounts. You have to elect those each year. We did all of our regulatory updates. We got the rates from the city. It was a very, very efficient process this year. We posted all your enrollment guides to the website so your members could access them very, very quickly. And again, it's part of our regular process. I think where there were some changes this year is you went back to the in-person benefit fairs, which was very beneficial. And telehealth was able to send representation to help people answer questions and partner. So really excited that Paul and the benefits office invited us to that and participated, and we'll continue to do that as you wish each year. So that was really exciting. And there are 4 of those this year. And then last but not least is we continue to look for ways to make the personal enrollment worksheets, the confirmation statements process more efficient. And we've shifted, as we did last year, we shifted a bunch of that work back to the city employees, your printing department, so you can get it more efficiently out the door and honestly keep the work within the city. There's no need for us to pass that cost on to you if you can do it in the city. So we continue to look for those opportunities with the benefits office, and we're continuing to do that. And that was what we did this year. So very exciting, but it was a very, very nice year. It was very, very quiet, which is good. Paul, if you can proceed. This is just a visual summary of what happened, which was not a lot of migration, and it was the punchline. You don't see a lot of movement between your plans. It's typically maybe less than 2% in any given year. So this just really illustrates that you're not seeing a lot of movement amongst plans year to year. We're going to dig a little bit deeper though, and I'm going to let Amy in a second go through some of the MOU details that are more specific to each of your respective groups. So,
Next slide, Paul. Thank
Really
you.
quickly, just for this slide, this is just the takeaway note. It's hard for me to determine there's 2 different colors that are very, very similar. And maybe it's my age, I can't tell the difference. So just a
I
little.
had the same thought.
Okay. So just
gotcha.
for sake, a little more contrast there.
Gotcha, Shauna. We will make sure next year we're a little more.
Thank you.
Yeah, and I think that we have future slides that will provide the data behind this that will make it a lot easier to understand the differences.
I might appreciate the primary color.
So for this slide, what we wanted to do was just make sure that we're detailing, like I mentioned before, there's some data here which represents enrollment into each benefit plan. So last year we provided cash in lieu on this particular slide, and on future slides this year we actually baked in cash in lieu on the breakouts for each MOU. We didn't do that in prior years, so we'll get to that in a moment. But this is really just showing those percentage enrollments, percentage change year over year. As you can see, there's not a significant difference. One thing that we wanted to do this year was to add in the new enrollees for 2023. So this is what either new hires or rehires that had an opportunity to enroll in their medical plan, how that broke out between those different 2,500 opportunities. Where did they fall here? So obviously, as you can see, the biggest numbers are the PPO plan and the Kaiser plan. The Kaiser plan, of course, is the largest percentage. What we did want to do here is kind of detail, and there's a note at the bottom of the slide that reflects the percentage of actual default enrollments as opposed to the active enrollments in the Kaiser HMO plan. So as you can see, there's a 36% of those new enrollees actually just defaulted, meaning that's the default option. They took no action. So actually a good majority of folks were actively enrolling in the Kaiser HMO as their choice.
Is it typical, like that percentage, is that historically, is that pretty?
Actually, it is. So we did, though we didn't represent this particular data on last year's slide, we did actually take a look into the prior open enrollment in the prior year just to see was there significant change really as speaking points for today's discussion. And actually, it's pretty similar. I think for the prior year, so 2022 ongoing new enrollees, it was, I think it was within 2 to 3% difference. So I think whereas it says 67% here total all in, but 36% default, it was within a few percentage points. I think the biggest difference was in the default. I think it was slightly higher last year. And if there's an appetite for us to dig in and provide that data after, we certainly can. But it wasn't significant.
Yeah, I was just thinking about that in terms of the immediately prior report and how that moves in.
So we will add a comparative year over year go forward. So you'll be able to see this data and compare it and see what's happening with it.
So, yeah, not really a lot to say. Again, we don't have significant, migration on, and you can certainly proceed, Paul. I'm not gonna spend a lot of time on the next couple of slides. What this is doing is breaking out by MOU, in kind of clusters based on, we have the, American Federation of State, County, and Municipal Employees kind of, grouped together. So we've done this year over year. Again, for, this year, we did break out and add in, the cash in lieu, so that you could see those percentages of enrollments, and then you'd see that larger total of enrolled employees actually included there for cash and lieu, which we didn't do in prior years. But really, if you take a look at the next couple of slides, and Paul, you can kind of slowly scroll through, there's really no significant migration as was reflected in kind of the all-in population. No significant migration year over year. No real big story to tell here to this group. So for this next one is the dental plan enrollment breakdown. So as you can see, there's a big, I wouldn't say it's about a 3.5% population difference. So plus 3.5% or so from 2023 to 2024. But with that, no significant migration in your dental plan enrollments. We did want to call out that while the default is that the dental care DHMO, we had about 56.5% of the city employees with less than 1 year of service. So those new enrollees. So when I say less than 1 year of service, the rehires are actually included in that population. So we're talking about people that had to make an enrollment choice in 2023. So of that population, we had about 56.5% enrolling in that DHMO again for 2024. So choosing that plan. So for this next slide, we're talking about the tax advantage spending account breakdown. When you take a look at the chart on the left-hand side, you're not seeing a significant difference in population enrollment for either dependent care or healthcare. We did want to kind of call out that there was an increase of about 361 individuals from 2023 to 2024. So while that seems like a small number, of course, your population did increase. A couple of things we wanted to add here is just a little bit of color commentary and context in terms of the actual enrollments in dollar amounts into these plans. So for healthcare, we had about $1,800 in average contribution goals for the year. Now, just to kind of call out for our other clients, that's about on par. So $1,800 contribution into a healthcare spending account is actually the average across the board. So that's pretty typical. Of course, the dollar amount in a dependent care spending account is significantly higher. So you get about $4,000 as your average contribution. People, of course, are really taking advantage. The folks that do enroll in the plan, they do take advantage of that from a tax perspective. And then we wanted to just kind of outline new hire enrollments here. So this is kind of similar to what we're providing in terms of medical and dental. This is a percentage of people that were new enrollees in the 2023 year. So about 5.5% of all enrollees that were new for 2023. That's 5.6% of those were actually the population of the total all-in enrollments for the 2024 plan year, and about 4.3% for the dependent care. So basically, of the folks that enrolled for 2024, those are the percentage of folks that were actually new enrollees in the prior plan year. So most folks are year over year contributing. So actually, Paul, can you take it just a quick step back? So wanted to just kind of outline the slide, or the graph on the right-hand side of this slide is really just showing kind of how the city compares to other clients of size. And so population size is actually has been increasing year over year. So where the city was kind of trailing a bit behind some of our similar client size and actual public sector. Those actually, it's been increasing. So right now, the city's about 14.2% to a 14.8%. It's actually been increasing year over year. We did take a look to see, was that communication in some of those benefit seminars. And really, I think folks are just, it's catching wind, right? That this is a tax benefit for them to take advantage of. Sorry. The next one here is just our enrollment observations, and I'm not going to walk through every single one of these numbers, a lot of numbers here. We do want to call out that, of course, as we typically see, most folks are making their enrollment elections towards the end of the open enrollment window. The city does have quite a long enrollment window, the entire month of October. So we did see 63% of enrollees making their active enrollment in the last 2 weeks, which is a slight increase from the prior open enrollment year. So you'll see that there's kind of a, not quite a huge shape in the, week 1 through week 5 enrollments. But we do see that kind of flattening out a bit. So a couple things we wanted to call out here was, we had email reminders, of course, that Paul, Chung, and their team are sending out. We're representing, those were sent out on October 1st, 23rd and 30th. And we actually did see a spike in activity of enrollment in those days. Of course, the first was on a Sunday this year, so the next day was day 1. But the other days, we actually saw a significant spike in enrollment activity that correlated with those emails and when they were sent out. We did want to call out that there was a spike, and the highest enrollment day was October 31st, of course, with 13.9%. That's, again, pretty typical.
That's amazing. That's such pressure. The last day.
Yeah, so
We're trying to flatten this curve out a bit, and we've done it a little bit, but we want to really drive down those last 2 weeks. And we'll explain why in a couple of slides later, but the more we can flatten it out and the more communications we can get people engaged earlier, the better. So to be honest with you.
Well, since I haven't changed my enrollment since my youngest son was born and he's driving. Is there an opportunity to go in, start changes, but not finish?
Sure, of course.
And so then you go in and finish, and that's when you count me? Or do you count me every time I go in and change something?
So we actually have some data that reflects that. We have, either unique enrollment elections versus all-in enrollment elections. So, you could have submitted 4 different times. You could save and not submit. So we actually do count that. We also have how many times, how many employees logged into the site versus unique employees logging into the site. Doesn't mean they made their enrollment elections. You'll actually see a difference there, but we have that data on future slides.
And so people who don't bother who just let it roll over, does that count as the last day, October 31st, or somewhere else?
So what you're saying is if they absolutely defaulted, they did nothing, they didn't save anything, that's considered a default. That's not considered part of our active.
It's not part of this chart. In other words, it's just a transaction where we audit systematically go and close it.
But you keep track of me too, who never even go to the site.
That's right.
Okay.
Well, we count you in our non-active list.
I'm going to the site.
I think on that last slide, the key is that the communications work that Paul and Chung and the rest of the team have done are yielding benefits, and we need to continue to look at that and refine that as we go out. Again, to flatten the curve out and just create a better experience for employees. We added this chart this year. We wanted to give you a bit of benchmarking against what other clients are doing, both public sector and corporate clients. And the punchline to this slide is that the city has the most employee-friendly enrollment period and activity that we're experienced with. That's not that others are bad. You're just very employee-centric and driven, which is really important. It's the engagement employees. You talked about retention, attraction, and retention. This is a good thing. You have a 30-day enrollment window. You have a correction period that's very long versus other clients. So, the period aligns with most other public sector clients. It's the correction period that's a bit unique because you have a very long period. And then again, there's a lot of customization that you do in your communications to educate and give people information, make informed decision. The personal enrollment worksheets, they're good. They're complex. They're hard for us, to be honest with you, but they're good. The confirmation statements, that whole entire process is very driven towards your employees. So wanted to make sure you were able to see that because it's something you're doing different that not everybody's doing. So, is there any questions on this slide?
What does the silent period mean?
Silent period means is that it's not advertised. So members are able to correct, but it's not communicated. So if somebody were to call and say, oh, I made a mistake, boom, you can do that. There are others that just do not. Like, they're just like, no, you have to go through appeal. And that's not a good employee experience, right? When you really know that you're probably going to end up giving it to them. So we'll continue to provide this information each year. Amy?
So this is kind of the slide that I was talking about earlier, where it's maybe a little easier if you're looking at your laptop, but This is a chart that just kind of reflects, number of employee logins all in year over year. Unique logins, page views. Again, one individual can click around for a half hour and we're kind of recording all of that activity. So that's not necessarily unique page views where we do have unique page views. That actually doesn't count one particular page, right? You could have unique page views as in this page, and then you click on a different area to see one particular benefit information or a guide, and that's a different page view. So really, we're just kind of highlighting the activity increases. So one thing we wanted to call out here, 83% of the city's 2023 active enrollments were executed online, which is actually a pretty high percentage. So we did want to call out that comparative clients have about 78% to 83% increase. So there was an increase for a comparative client that we're using here. But the city does actually have a high usage of online enrollments versus calling into our benefit service center. We did want to also call out just a bit of data here, 32% increase in the unique users logging into the enrollment system. If you compare the number of actual unique logins to the percentage of online enrollments, there is a difference, right? So folks are logging in and perhaps not taking action. Perhaps they went onto the site to during the open enrollment period, but they actually didn't want to make their benefits. They just wanted to get the new enrollment guide, take a look and say, yep, I'm doing just like I did last year. So we did want to call that out as well. And actually just, this was the slide that we want to make sure we're calling out. We have a target of the website that 99%. We did actually but exceed that goal. So the site is up, running, and your employees are taking action by making them online better.
What's up? Transition a little bit of the service center. So as you can see, our call volume was down a bit. There was a statistic in here. It's the average speed to answer. We were lower than we expected to be. And mainly that was driven by the call patterns. It's driven by call volumes. There's a finite amount of call center resources. The good news is low abandonment rate. We're doing bilingual calls. So if it's Spanish or English, we have representatives that are available to take both those calls. We did pull out the annual enrollment calls. So 92% of those were answered within a minute. That impacted your what we'll call other calls. Again, wanted to call that out. We had 11 additional resources trained this year and cross-trained on that. And there was a lot of activity that the city did with us, whether it was culture training. We continue to bring the city benefits team and our own internal staff together because we have to do a lot of hiring during this process to chastise the call center during this period. So a lot of investment was made on that. But there was, again, the talk time went up. We don't penalize our reps. However long a call takes, it's how long the call takes. So we don't drive your members off the phone. We want to answer their question. And we'll see those results in a minute because we actually have some good, really, really exciting. So a little bit lower on the stats than we wanted, but generally there was no complaints about that. So Paul, if you want to maybe flip the next slide. Oh, I'm sorry. This one. No, this reflects all the calls in the service center during the period because some people don't click the open enrollment option. And we think it's more important to represent all calls that come in because some people try to circle. We've all worked with IVRs, right? Press 0 or just try to get to a rep. So we think it's more important to represent the whole service statistic for the metric. We carve out open enrollment on the slide to show that for that call, you did well. But we think it's more important to be transparent with you is that it was lower than we wanted for that experience. But the good news is we are really proud and excited in this slide. First of all, we did experience retaining talent is much harder. So we actually, if we needed 11 reps, we hired 17, run that through training, and we build redundancy across teams. Because the city is part of a lot of calls. So we experienced higher. It's costing a lot more for call center reps. It's really high, really high. The good news is that being part of Palace organization, which if you look at TELUS, their parent companies, our parent company is a phone company. Okay. But we have a division that purely just does phone. We have over 80,000 representatives across the world. We do your work in the US, just to be clear, for phone reps. But it gives us more scale as an organization than we had under LifeWorks, to be very frank, and we have higher capacity. So we're going to start to hopefully see those benefits. I'm not gonna say go, Sean, yet, so you tell me. No, I'm sorry, I didn't mean to. I think Paul's got me under a deadline, so he's pushing me through. This is the slide, we've talked about it, and I remember sitting here over the past 3-4 years. CEO, CEO would always ask us, you would ask us, what are you continuing to drive member satisfaction up? It's not about the 95% that go right. It's about the 5% or X% that don't go well. So this year we met our performance target and we've been meeting it. One of the things is that your members reported 98.64% satisfaction. And that is extremely high. We're really proud of it. And that didn't happen in a vacuum. That happened with the health and benefits team. It happens with, us participating in benefit fairs. It's the training we're doing. It's the continual investment in our relationship. And we are pleased about that. We're not letting up. We're hoping to continue to keep it rise, but this was a really, I think, a pivotal year. We're still doing well, but how do we get better? Because those people are supporting all the people of the city of Los Angeles. And we want them to feel like they're being supported. So really excited about that. It just shows the investment that we've made over the years. The stats decreased, as you can tell, because the satisfaction went up. One of the things we continue to do, and we will continue to do, whenever we get a member that's dissatisfied, we will call them back. That doesn't mean we always reach them, but we want to know the why. And the themes haven't changed much. It's either technology, they maybe had trouble logging in, they maybe didn't like the plan rules, or to be very frank, maybe the customer service rep did not provide good service. In the cases where we can act upon it, like customer service rep, we provide training. If it's plan question, come back to Paul. If it's technology, we'll try to find out if it was their technology. Maybe they were off of a bad internet connection, or did we have a blip in our technology? So we are triaging all those cases. So a lot of work, but we think this is important because this is your members' reaction to that. And we're going to continue to do what we're doing. So Paul, I want to give it real quick.
Yeah, so just some stats here in terms of AVA, which is our automated assistant. So this is we'll call it a chat bot. It's a tool or a widget on our site that essentially allows, city employees to ask questions about their benefits. So this is just representing kind of the volumes that we have month over month in the 2023 year. The types of inquiries that are coming in, what they're clicking on in terms of their inquiry, and those are reported. So it does reflect 1,700 total interactions with 517 unique users. So one thing that we're looking to work with Paul Chung and their team on for 2024 is to expand AVA and the things that it can answer for city employees. So, some potential things are, SSO links. So there's a single sign-on. So let's say that you were on our site and you click on Anthem site, right? That you're actually able to click on that site and get right in the login site. So providing some SSO links within either AVA and or our site. So how is it there? But if you are asking AVA a question about your benefits, SSO links are there, so that we can get folks where they're trying to go, their questions quickly. And then potentially adding in some additional types of questions. So some things that we're working with Paul and Chung on, or maybe payroll workday questions. Those are some things that we can plug in, and what AVA can do is we can say, these are the types of questions and the way they might be phrased. And then we can plug in the types of answers that we wanted to see. So if somebody asks a question in a way that's not verbatim how we programmed it, they can actually say, we get it, we know what you're trying to ask, and they can plug in some potential answers there. So just some things that we're working with Paul and Chung on, just to see, is there any other value add questions we can add to this? So more to come.
And the last side is what do we have upcoming? We have open enrollment. We got another enrollment that's going to be starting, believe it or not, where we're starting that planning. And we have some commitments we've made through our contract extension that we talked about last year that we're sorting out. But at the end of the day, is our number one priority outside of the member experience we talked about ongoing is the Workday project. We understand the risk. We would be remiss if we didn't say as we're very concerned. It's just because these are big projects that have been through. The good news is we use Workday as a company too, so we do have some experience, but we're risk mitigation planning, and we're doing some of that by a couple ways. We've expanded our project management team. We've added an additional resource on our side to help manage the risk, and that has extensive experience working in this type of convergence. It's a new ad, but so we'll be working with this qualified enough to leader. And then part of the we do have another colleague here, Daryl Brooks, who's joined us. He's also going to be helping us from a client perspective and a risk perspective, assisting me and Amy to make sure that as we go through this list here today, that we're allocating and managing the resources appropriately for the city account. This is a big year for us with you. And we have a lot of commitment. So, you know, our number one priority though is as we go through this, and it is in this order, and you may not like the order, members' access to care is the number one thing as we go through this. People cannot go to the doctor or emergency care and not get it. So we're figuring out how we build triage teams and connections with the city on that. And then obviously their payroll, you know, access to care and don't mess with people's money, usually pretty good. So those are the two things we're prioritizing. We know there's going to be, we're expecting a lot of manual work. We hope there's not, but we're anticipating it. So we're just going to need to continue to have open communications, and we have that with all the team. And we appreciate their support. We talked about kicking off annual enrollment. So that process is going to be starting. Sounds like we have a lot of initiatives going on based on previous discussions, so we'll prepare for that. Amy hit on the automated virtual assistant. There are some other things though. Can we create connections into Workday actually? Like if someone comes to our site, then we create an SSO for an active employee to get into Workday. We're going to try to explore those. Not sure we'll have them day one, but what can we do to make sure we can get questions and answers out there and links to members and to the carriers? Because those are all the things that are important to the members, we believe. And then there's some direct billing streamlining we want to do. Really, it's some process improvement. It's hopefully to take some of the work off of the city team that they're doing in the process and relieve them so they can focus more on strategy, some of the tactical things. And then we talked about the adjustment of the self-service tools and links to our carrier partners who are great to work with. We appreciate their partnership with doing more SSO and making sure when somebody goes to a website, they can get to this. Where we're meeting them where they want to be met and they can get to the right place quickly. So that's how we're thinking about this year and our commitments back to the city. So, sorry. If there's any questions or comments or concerns, anything you're hearing from your members?
A really quick question on one of the last things you said, direct billing. Would that be like the members if they're under the required time to be able to pay directly, or for the city to be able to pay directly? Because right now I know there's employees sometimes have to lock in that check somewhere, and if we're ill or whatever, it's.
I think we're looking at it multiple bases, but we call it. I think we're looking at is there city activities in the background that are having to do. We're going to streamline those. Second thing, in parallel with that, we want to starting to look how we can streamline payment processing, getting invoices out, and getting easier.
So right now that bill is separate from the system, separate, just mail them. If they go into their account, they call the call center, they can't see it. And so the first phase they decide is putting the bill in the system, so it's all there, and then getting, so they don't have to put that check anymore. So you can.
Yes, we're going to get there. We're going to get there. It's going to take a little bit of time. We got a few other things ahead of that.
Yeah.
Yeah. No, good question. Anything else? I just want to thank the benefits team, you all, for your support, and Siegel helped prepare this presentation. Thanking Siegel, we really appreciate the opportunity to you and your employees. So thanks.
Thank you.
Thank
you. Okay. Under item number 7, we have another presentation from Keenan and Associates regarding healthcare trends and cost management.
And I wanted to give a brief intro. Go ahead. So our next meeting in May is going to be very heavy with renewal items, and we're bringing in healthcare renewals. And so wanted to have Keenan kind of tell you what they're seeing and kind of set you up to know what you're going to expect when we bring the healthcare items forward.
Thank you, Paul. Good morning, Megan Gardner with Keenan Associates. I'm joined by lead technical consultants, Gordon Dar, and that was a great Yeah, we really did want to provide you with some context of kind of what's happening out in the industry and the market on a variety of fronts, with respect to healthcare, the trends that we're seeing with renewals currently, to set the stage for the city's renewals, which we have received Anthem's initial renewal very recently. We are digging into that, having initial conversations, and they're still pending Kaiser's. So we plan to bring a pretty robust report on medical renewals at the next meeting. But before that, we just kind of wanted to talk with you about that pebble in a pond that is happening and still happening with COVID, the ripple effects coming out of that, what's happening out there with regards to contracting for carriers and the whole plethora of things that are impacting trends out there in the marketplace. And so to that end, we prepared a pretty detailed memo. We went through a number of items, hopefully had a good time reading that before bed and put you to sleep or anything like that. But we are seeing the continued advent of telemedicine effects on healthcare. Obviously, there was a big drive towards that with the pandemic that has continued to be a mainstay in the offerings from carriers. In most cases, providing savings to plans. Carriers are definitely taking advantage of that. Some providing virtual care only plans out there as a mechanism for cost. So telemedicine definitely saw a big surge, and it is here to stay. Mental health continues to be a large focus. There's been a lot of challenges in the mental health arena. We've talked about this before on a number of fronts with respect to the AAP, and also on the medical side, they're seeing that as well. There's staffing shortages. It's hard to find and maintain clinicians on that front. It's a tough industry. Burnout is a huge factor, but mental health does and continues to be a mainstay and a challenge for carriers. On the employer side, it's also a challenge. And to that end, employers are looking to expand offerings, provide support in that arena to help care for their employees as they should. In the arena of innovation and advances, we're seeing a shift or a surge in personalized medicine, meeting folks where they are at. Virtual, this does have virtual component as well, concierge services, where you have a personal physician that does see you in your home or at another location or at a physical location. We've seen things like Amazon getting into the medical care business, both for care and pharmacy. So there is that more customized one-on-one shift that we do see happening. It is kind of in the early stages. I mean, concierge medicine has been around a little bit, but it's really starting to grow legs. I think that is an event of the telehealth and COVID as well. So we're seeing that kind of bubbling up. Does impact what's happening out there in the medical industry, and then also with that. I think the shift towards concierge medicine has been driven out of a need for more personalized chronic condition management. So we are seeing some innovation in the chronic disease and value-based care arena. Nothing's off the table these days. Folks are trying holistic medicine. They're getting care that works for them to manage conditions. We have obviously prescription drug innovations for weight loss. Everybody's heard the Ozempic and maybe Zepbound innovations that are coming. Folks are becoming very personal to them. There's that ripple effect for one condition causing and having an effect in other conditions. So managing chronic conditions, weight loss is a big deal these days. And then, of course, economic considerations. Everybody has heard about inflation. It's impacting real estate. It's impacting car buying. And it's much the same for medical. It's impacting cost of how care is being delivered. Most immediately on, Kaiser obviously is a single care hospital model. They feel it most immediately. It is impacting Anthem as well, your carrier partner, as well as other partners out in the industries in the way that they're contracting with certain hospital systems. So economic considerations, inflation, all those costs are putting upward pressure on the trends that we're seeing.
Just add more
Yep.
specifically, she is the inflationary trend on large. They're fortunately getting larger faster than your underlying. So look at about 80% of the population. And their costs are well under control. But it's at 20% where it might be $1 million thing this year, it's going to be $1 million next year. And that's the area of concern, managing those markets. That's
Most parts are growing quite rapidly given the economic factors that are out there. And then again, managing pending legislation, existing and pending legislation. It becomes quite complex for employers and carriers alike. There are a number of reporting requirements that they are under. And we've listed out a few in our memo, but mental health parity, COVID vaccine requirements now being covered by the plan. So that came out of that. And also to the gag clause reporting, all of those things take resources and time. They are complex and they are a compliance aspect of plans that both employers and carriers are grappling with. There's some pending legislation that we are watching out there on the horizon. Single payer healthcare has come up several times. It's out there on the forefront again. So we're watching that, as well as California AB 2028. So there's a number of things that are out there on the legislative front that are also impacting how care is being delivered. And I'm going to pause and turn it over to Gordon real quick. Just we talked a little bit about the large claims, but pharmacy costs as well.
Yeah. So in particular, the same thing is being realized on the pharmacy side as well too. A couple of years ago, I think in 2022, there was the introduction of the most expensive drug. It's a drug called Zolgensma, and today it's ranked at the top of the highest cost of drugs. I believe it's Zolgensma. It's a hemophiliac drug. It's wonder drug that may help you knock you out surgery. But we continue to see this true escalation cost in the prescription drug area, which is problematic. We do need to look be creative relative to solutions, and we'll continue to do that with you. We're looking at control those things. It's tough for health plan to take on one. Imagine if you had several.
And with respect to the city's plans, we've had conversations with both Kaiser and Anthem about the prescription drug costs and talking with Kaiser in particular about those weight loss drugs and how they manage and dispense those and what that looks like, and ensuring that it's a pretty robust process and a medically necessary process at that. And then on the Anthem side, I think Anthem has reported out to this committee about there's one high cost pharmacy claim in particular that it's a life needed drug, and they are managing that. It is a very unique and rare condition, but that is specific to the city that your plans are kind of grappling with those costs and how they maintain and how they kind of help control. So and then last but not least, we did want to provide some context of what we're seeing out there with respect to trends in renewals on a variety of different fronts for our carriers, both on a fully insured and self-insured basis. And Paul has it up here on the screen. Thank you, Paul. These are second quarter 2024 renewal trends that we're seeing. Obviously, we are working on a 1/1/2025 renewal for you, so it's a little bit further down the road, but just wanted to have you have some color and context in front of you with respect to what's happening out there. across the board with the state. And again, we'll have more to come for your specific renewals next month. So just want to pause and open it up to any specific questions that we can answer. This time.
I mean, I'm just curious about those like last minus years was you were talking about. Is that over the course of the illness? That cost?
It's a one-time treatment. Fortunately, it only happens like a year.
Okay.
So it's not like they're going in every month. They could, and you know, and this is where. How creative do you get? Do you introduce, it's called medical tourism. Do you introduce them and tell them, let's get you that drug, but it's a lot cheaper for us to fly you to another country where price control is in place, where it's not $1 million drug, but a very affordable drug. You know, I mean, those are the type of things that the future is looking at, because I can tell you the sustainability of $1 million drugs for health plans within the United States is not an option. We have to start looking globally at some of the solutions where we've been more of a free market here in the US relative to healthcare. And we're not talking third world countries, we're talking development. Price controls in these areas in place. And there is legislation relative to some price controls, but unfortunately, that's going to be on the Medicare front first. We can only hope that very quickly that gets accelerated to get more mainstream and commercial application.
Quite frankly, the legislators are watching and they're looking at some of this, because they recognize that it's not sustainable. I mean, the work that's been done with respect to instant drugs and having costs there and making it for it's good work, and bring that trickles into other areas as well. As these things continue to be.
I just had a question about the subcontractor that's used for reviewing cases or plans with Anthem or any of them. Do you have any reports on the any issues that may have come up, or just any type of reports on the subcontractors that they're using? Like, is that a successful, are they successful? Is it something we should be looking at when we talk about the newer contracts as far as the subcontractors that they're using? I'm specifically thinking of Anthem and Carillon, I think. So just wondering if that's something that, do you have a choice, or do we have a choice as we're looking at the new agreements?
Carillon acts as Anthem's pharmacy benefit manager. So it's not a subcontractor, it's part of our organization.
Oh, it's just like another name of a division of your.
Correct.
Oh, got it. Okay. Okay. Okay.
And there are, there are clinical edits and prior authorizations that therapy can apply. So your formulary that you use for the city is our most generous. And we did that, you know, as by design by the JLMBC, right? We wanted the richest benefit from that. There are other formulary options that could sort of migrate members to more affordable, you know, there's change in that, right? There's disruption that potentially offers savings with future years if they're interested. But all of those clinical edits are all in place and designed to make sure that, you know, the members are getting the right medication and they're trying other medications first before they're the most expensive. I think, you know, Warren's example, while extreme, that does save a person's life, right? And we saw something most recently with Humira, which was one of the top medications for many years, and that just became eligible for other entrants into the market. So we're seeing a huge cost reduction in Humira. So, you know, some of these gene therapies, while they're, you know, very helpful, they'll save lives that we've never seen possible before, which is terrific, but it does come at a cost, of course. But to that point, over time, those medications eventually will go to generic, or there'll be other entrants into the market that will compete with us. So it's a balance of everything, trying to figure out the, adequate choice with the least amount of disruption at the right price point, but our therapeutic teams look at that continually to make sure that we're offering the most affordable.
Specific to subcontractors, I didn't cover the contract process. Leading to balancing some of that at the time and looks at those.
I just assume, because I don't know if there's a retiree group that's looking into that, and the impression, and just not singling out Caroline, but it's just, or Caroline just happened to be what was mentioned. It was the assumption the way that it seemed was that they were like a subcontractor of the group. I didn't realize that they were part of Anthem.
Yeah, and this is gonna sound like a personal event, but I just spent over $100 on an inhaler. How was that? That was my COVID, and that was after applying Good RX. So, and it's a regular thing. It's not some fancy $1 million drug. It's everyday inhaler. So, but you just said we have the most generous formulary, and I find it's not generous in my end when I go to get stuff. I've completely had things that told Caroline sends me a thing saying we don't cover that. It's like, but my doctor said, and it's just like cough medicine. Or I go in to get the inhaler, it's like, oh, it's 150. I'm like, I have insurance. Well, that's how much it is. I'm like, are you kidding me? Yeah. So we're not talking about the $1 million drugs. On a day-to-day basis, we still are seeing really high out-of-pocket costs. So
certain medications that are available are not covered under the benefit program. And we do that because we're trying to share for and we're trying to make this construct. So a member can get it over the counter, that's kind of by that cough medicine, wasn't covered. For them to be able to look into your specific notes to see if they're putting in a more affordable inhaler, and therefore you're getting a better cost for it. I don't know if that one you can tell, but I'm happy to check that.
And who's supposed to do that wrangling? Like, I'm at the pharmacy trying to pick up my prescription, and whose job is it to say, well, there's really a cheaper way to go, and that's why the pharmacist doesn't.
Yeah, we just introduced a new program that's automatically embedded into their pharmacy benefits, where like you suggested that you use Good RX certificate coupons. There's a lot of those different benefits that exist now, these different coupon codes. We have now integrated that into our own systems. So when you go to the pharmacy at the point of sale, we're looking at all the different coupon codes that are available and apply the highest, most generous coupon code to you. So sometimes you'll see your copay will vary depending on that given point of sale and what the better components behind the scenes. So that just started on March 1st. So that's nice benefit for members because, Good RX, I've used it myself personally before this plan came into effect. It's a little bit of a hassle, right? Because you have to apply and get the information for pharmacists. So that's what happened behind the scenes. You did additional credits. But again, I'm happy to look at that. We also have your on-site custody nurse, Marina. She's terrific. I can share her information. She does a lot of that shooting for members. And we can also look at the after the fact, like credits.
Doesn't sometimes it really comes down to what the doctor prescribes. If they're generic, the question is why isn't he or she prescribe? No, give me the option for generic where it could be cheaper and still provides the same type of medication services.
And it's like prescriptions written, right? Because there's dispenses written, and they're really trying to get you the best medication. But even still, if our edits say, this medication is equally as effective and more efficient as far as costs, then we'll try and get you the medication first and try before you're that next level. So we still try to stop that if possible. Doesn't always work, and sometimes the numbers have adverse reactions, right? So there's a reason why they're on that higher cost medication. Every member is so unique. So, trying to balance that you're absolutely right with the doctors. We're not, they are the ones that provide the care. We are not that, right? So
Okay.
I think she maybe could have a discussion with the doctor and see if there are other options out there.
Okay, thank you.
Thank you.
Questions, guys?
Would Kaiser like to come up and answer questions? No.
No.
Okay. 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 So in the interest of time, I know that we are losing a couple of members, and even though that these are informational items, I still, would like to have, a group, a quorum here, to discuss these things. If possible, I'd like to hold the disability claim report until the next meeting. Is that something that is within my scope to do?
Yeah, we can continue it.
Continue it to the next meeting?
Oh, we do. Yeah, it's information. Yeah.
Yeah. Okay, because it's an information only item, we don't have to vote. I can just continue it. Okay, outstanding. Okay, so then if we could, hopefully these next items are not as meaty. Item number 9, the committee report on the HRP update.
This will be extremely quick. So this is our standard report that we've been bringing forward to you, the update of progress. And so it's been the same report. We just update the progress. The update of progress is that we did finally start testing. We were successful enough to begin testing of our integration files. There was a lot to do and a short time frame to do it in. We are working with everybody to try to make it happen and complete before go live. It is an ongoing process. In addition to the testing, and so further down is our testing process. So we started with our outbound file, it's outbound, inbound report, outbound, inbound report. We're trying to do at least 2 or 3 cycles in this. So we're in the very beginning part of it. There's still, even in this, a lot to finish. So we have a lot to do. It is promising, though, that we have a path to do it in the time we have allowed. The other item in this report is just training. Staff is very concerned on their ability to understand the system before it goes live. In our experience of attending trainings, they don't go deep enough into the subject matter to really give staff what they need. So we're going to be developing our own. We've gone around this a couple different ways as much as possible. We did ask the Workday Accenture team to create a training for us. They kept it at extremely high level, and they're making it open to the public completely. It's not giving what staff needs. So we're going to develop our own and work through that process to make sure that staff know exactly how this is going to work moving forward. It's just more work on us, but that's what we need to do. That's it.
Are there any questions? Okay, thank you so much, Paul. Moving on to item number 10, the committee report on the projects and activities report.
Good morning, everyone. This is Chung with Employee Benefits, and I will be going over some of the highlights for the projects and activities report today. First up on page 1, we have another update on the Anthem and UC Health Network agreement. Previously, we had reported that both parties had agreed to a new contract in principle, and they had extended the existing agreement to April 1st in order to allow them time to finalize the new agreement. However, a bit more time is needed, and so the current agreement is being extended once again, this time to April 15th. And as before, Anthem will be mailing out an updated letter to affected members. Okay.
Can you state your name for the record?
Oh, yeah, it's just announced them, and just on that UC health negotiation, as of yesterday, our next agreements have been signed, and now we're in the process of updating our rates. So,
Thank you.
Yeah.
Okay, moving down to the projects sections, we have an ACA update. So the city's 2023 ACA tax filing has been submitted to the IRS. With this step completed, the filing requirements for the 2023 tax year is almost complete. We are now in the correction window for the ACA filing. We are working with our consultant Benefitscape to identify if there are any corrections needed to be filed for during this window. The Benefitscape contract has also been extended. It was originally a 1-year contract with 2 1-year extension options. The city has recently exercised both options, and the contract is now extended through August of 2025. Okay, and moving on over to page 2, we have an update for both the health and dependent care spending account services RFP, as well as the life, disability, and AD&D RFPs. So for the former RFP, we have received 6 proposals by the March 21st deadline. For the latter RFP, we received 9 proposals for the life and the AD&D insurance services RFP, and 8 proposals for the disability insurance services RFP. The benefit staff teams for both RFPs are currently working on completing their evaluations of the proposals. But due to the number of proposals received for both RFPs, staff is recommending that a special meeting be scheduled in May to allow sufficient time for staff and the city's benefits consultants to present the concepts and options to the JLMBC. So the special meeting is being planned for May 16th. Okay. And that brings us to the end of this report. I'm happy to answer any questions you may have about the items in this report, and also to take any items that you may want to add for the calendar.
Do you have any questions? Do you need a motion to add the meeting or?
No, so we already put it out there from the beginning when we did the plan for the year. We just put it as tentative, and now we're saying it's not tentative anymore. It needs to happen. And just to drive it home 100% on what Chung said. So our May meetings are going to be medical renewal, life insurance, disability, and AD&D renewal, healthcare, dependent care renewal. It's a lot to digest. It's going to get very, it's just going to be a lot.
Okay, thank you so much. I
Thank you.
appreciate it. Okay, and our concluding items, item number 11, do we have any requests for future agenda items? Okay, hearing none. Our next regular meeting date is May 2nd, which is a regular meeting. And then, of course, we just talked about the May 16th special meeting so that we can talk about the insurance RFPs. And then we have a regular meeting on June 6th, 2024. Oh, well, I covered those 2 together. All right. And if there's no other things that we need to discuss, the time is 10:50 and this meeting is adjourned.
Right under the wire.
Rerouted.
What the